So muscles in this area then. If I'm looking at the back of the scapula, muscle in there, please. Yeah, and this other little one down here. Yeah, and the one below that, the bigger one. Yeah, and then medial border into the spine. What have we got just here? And
lower bit of the trap.
Yeah, lower traps, mid traps, and some other stuff up here as well. Upper traps, and what's the other one just in there with that knobbly insertion? That's the levator scapula, yeah. So we're aware of all this. I think we'll start with the rhomboids, and then we'll see what we can find. So what we're looking for more than anything is a visual. But Kate, while we're working through the area, I might ask for a number from you. So that will be between 1 and 10, with 10 being extreme pain and 1 being barely noticeable. I would try to avoid going above a 7, an 8 max, so let me know if we get there, and then we can stop. The reason I mentioned all those muscles, I want you to try and visualize them. I'll get them up on the screen. We need to think about which way the fibers are going. And rhomboids and upper mid traps, they're going in a slightly different direction, but really kind of same way. So we want to make sure we're strumming the guitar strings first, going transversely across the fibers, so we can keep an eye out for the twitches. And we're just looking in the general vicinity. So try and keep a vague eye over that whole area, and you can let me know if there's anything that I miss. So I'm reinforcing the thumb first, very slowly working through. There's one. So there's a nice one there that correlated with a from Kate. Yeah, let's go back to that. And sometimes just in going over that area again will actually count as a kind of treatment. It goes away and you frustratingly try to find it again, but you won't. So let's have another look. Eyes peeled, somewhere in this area, I think, wasn't it? There?
Yeah.
See it? Still going. There you go. So bang on it now. So what we might do there, we've gone transversely. I know roughly where it is. We can go longitudinally, which is going to be that way. And I can work across, and not across, in line with the fibers. More difficult to find. Let's go back to transverse. We're more or less on it.
If you release your pressure, do you have to sort of go back to the start again, or?
Yeah, I'll talk you through that because we're going to go through a whole treatment. Might have to find a new one now. Look, it's twitching all over the place when we get to the levator scapula.
Yeah, my right side
Come around this
horrendous.
side. Okay, I'm glad I picked on it. Have a look. I want you to really see what I can see because I'm running out of trigger points. Next time I land on one, then we're going to go for it. Come on, twitchies. Where have you gone?
You fix it.
I know, it's gone, isn't it? Tends to happen. So as I'm passing through the area, Kate, I want you to let me know, because we've run out of visual twitches now, because I just got carried away there. But maybe that's what it needed. Let me know when we're at the most painful spot, okay? The most tender spot. Very, very slowly visualizing those tissues moving underneath your thumb or hand.
Just there.
Just there. That's roughly where it was when it began. And I can feel a bit of twitching there, even though I can't see it. Maybe my other thumb's in the way, who knows? And what number would you give me there?
5.
Okay, that's a good place to start. 5 is important because we need that to drop down over time. So I'm going to hold this with a constant pressure, and now's the time to get yourself in a sustainable position. So what that might look like for me, although I'm demonstrating to all of you, is to keep the thumb where it is, reinforce, get yourself in a strong position, lean the body weight in. So number there, Kate?
6.
Okay. Deep breaths. I want you to relax into that as much as you can. 6 should be doable, and 8, they're going to struggle. And what we're looking for is a reduction in that number. So you're on a 6, ideally we're looking for a 4 or a 3. You can let me know when we get there. Might take 20 to 30 seconds, and if it doesn't drop down, what we're going to do?
Let it go.
Probably just move along, yeah. Barking up the wrong tree here. Number there, Kate?
I'd say 3.
Perfect. Deep breath in, and as she breathes out, I'm going to just go in a bit deeper and try and find that 6 again. Number there? Yeah, okay. Keep those deep breaths going because you're putting some pressure down on the thorax, on the rib cage. There's a tendency for them to start to shallow breathe. And I actually quite like to synchronize my breath to theirs. That sounds weird, but it does something, especially with the inhale, exhale. Number?
Oh, it's just the pressure now.
Good. Okay, one more then. Deep breath. And breathe out and relax. Pushing down, adjusting my posture. Thumb underneath is completely relaxed. Number?
I'd say probably maximum of 3.
Perfect. Okay, let's hold that now until that completely drops off. Either that or about 30 seconds. The total technique's going to take 90 to 120 seconds. So a minute and a half, 2 minutes. Hence, getting yourself in a sustainable, comfortable-ish position. I might even use my elbow for this if I really wasn't concerned about anyone seeing exactly what it was I was trying to do. Number?
Go on.
Good, perfect. So how do we come off of that? There's a few different ways. My preferred way is a slow release.
Yeah.
And then some effleurage. Really light effleurage through the area. There are different ways of doing it. Some people come off with a little friction. Some people come off with just an instant, I think because they think there's some kind of neuromuscular reflex there. Possibly there is, but I think the friendliest way to do it, you're trying to facilitate relaxation, is to come off slowly. So what's happening during that procedure? Like I said, those fibers there, as indicated by the twitch response, as indicated by Kate's subjective, yes, that's painful there, it's a number 6 or 7, they've become locked in a localized contraction. So my explanation that I use for clients, although very much simplified, is we're switching it off and on again. We're depriving it of the oxygen that it needs to maintain a contraction so that it eventually releases. And occasionally you will get a spontaneous release that you'll feel and they'll back up with, oh, it's gone. And that's the most satisfying. That's quite rare in my experience, but it does happen. Usually what we're looking for is a slow, gradual release and drop down of that number from a 7 down to ideally a 0. If the pain didn't reduce, we would have just moved along. If it was unbearable, we would have released the pressure. And that's it really.
It feels better already, thank you.
Good. And even just going through the area, just try and keep a real sharp eye out when you first start, because they can just disappear quite quickly. There's a couple just in, oh, there's one little twitch just in there. Oh, there we go. So there's some more work that we can be doing along here.
What are the chances of it coming back? Is it like more prone to coming back on that particular muscle place?
Yeah, it's a good question. It just depends how it came about in the first place. If it's postural and they don't make any postural changes, it could come back. If it's because of an injury, hopefully it wouldn't come back because that was just a one-off. There are other factors you can go with the biopsychosocial route as well. Trauma, stress, where they hold their tension, that can all come into play as well.
That's a big one actually, stress. Especially in the neck and upper back and shoulders. It's huge, I find. It makes such a big impact. Yeah.
If you're struggling to find one, Kate, put your right hand behind your back for me, please.
There.
Good, yeah, and then relax this arm down. Good. That just puts these tissues on a bit of a stretch. And so, oh, there we go. Okay, I should have done that in the first place, shouldn't I? Look at that.
Yeah.
See that? Lovely ones along there. Oh, now we're down there. Down there again. Probably rhomboids / mid traps. So really pay attention to those first few strokes that you're working through. Don't just hammer them straight in. Bit of effleurage first, and then start to slowly increase that pressure. Make sure you reinforce your joints, put yourself in a strong position. So to recap then for your practice, I want you can pop the arm straight in that position. I want very slow, maybe reinforced thumb, something that allows you to see what's happening with the tissues rather than covering it all up. Keep your eye out for what's happening. Visualize the muscles as you work across them transversely. And person on the couch, communicate with therapists as well. Let them know, yeah, that's particularly painful, that's not too bad. How's it all looking?